Welcome. Perfect. Sorry for the late start. There was a little bit of a audio interference on my side. Welcome to the Smart Data and Digital Health Services Beyond COVID 2019 conference. My name is Selçuk Candan. I'm the director of Center for Issued and Scalable Data Engineering at Arizona State University. Sorry, the audio interface was continuing. I had to reduce the volume on my side. I really apologize for the delay. So again, let me start again. My name is Selçuk Candan, and I'm the moderator and the chair of this panel session. Before we start, I would like to thank, first of all, the IEEE Services Congress for giving us the opportunity to provide this panel to the audience. In particular, I would like to thank the steering committee chair, Carl Chang, general chairs, Elizabeth Tino and Hong Bei, symposium general chair, Rong Cheng, and program chairs and chief Ernesto Damian and Zijin, who made sure that we have a space in the program. Again, this panel is co-organized by IEEE Conference on Smart Data Services, SMDS, and IEEE Digital Health as a Service Symposium. And we thank a lot to the organizers of those two events who make sure that we have a very strong panel, which we hope you will enjoy. So I would like to first start with setting the context for this panel. Why are we having this panel? Right? I guess anybody who's attending the IEEE Services Conference will agree that smart data services are a reality today. We have smart data, we have database technologies, we have data-driven services in all aspects of our life. This basically is in the communities that we live. Our personal lives, the way we move in the cities that we live, the economy that supports our activities, the environment that we all share, and of course, basically the governments that basically enable all of these. So smart data services are a reality. On the other hand, we also basically, I'm sure that all of us are perfectly aware that COVID-19 has made each of these smart services almost very difficult, right? So the economy is significantly affected. Our communities are significantly affected. Our governments are struggling to respond to COVID-19. Our lives are significantly affected. We are currently living through very complicated work life setups. And of course, our mobility is significantly affected. We are not able to move. We are having this conference, instead of all of us traveling to China, we are having this conference virtually, which means that basically we are definitely affected from COVID-19 in all aspects of our life. So given that COVID-19 is not going to disappear in any form, at least not soon, or given that basically different pandemics, even if basically COVID-19 disappears in sort of short to medium term, we are likely to have basically other pandemics in the long term. So then the question basically becomes, how can smart data services help enable communities where inhabitants live and work collectively and in harmony, and where the community as a whole functions as a system that is resilient, self-sustaining, livable with and beyond COVID-19. So that was basically the question that we thought we might basically be able to answer. The smart data services are part of our life. They should also basically be part of the solution towards COVID-19. The question is, what is the role of smart data services as a solution to support and enhance our lives beyond COVID-19? To hopefully answer this question, we invited 5 experts that are basically tackling different aspects of this challenge. We have Gerardo Chauvel, who is a computational epidemiologist. Ernesto Damiani is a big data expert. Murat Kantarcıoğlu looks at privacy and security challenges. Balakrishnan Prabharakan, he's an expert in human-centered computing. And AJ Royoru, who is an expert in healthcare and life sciences. So the way we would usually do this is we would basically first sort of start the panel, and we will introduce the panelists individually. But given that we are having this technical sort of challenges, right? What we decided was we will first introduce all of the panelists one by one, and each one of them basically will be brought to the stage. And then we'll basically start their presentations afterwards. So let me go ahead and start. Gerardo Chauvel, I hope you are also seeing my screen. Gerardo Chauvel, Professor Chauvel is a professor of epidemiology and biostatistics at Georgia State University. He's also a senior research fellow in the Division of International Epidemiology and Population Studies at NIH. His research primarily focuses on understanding transmission dynamics and control of infectious diseases, epidemics, and pandemics. And in this process, he basically tackles the challenges involving integrating diverse sources of data with mathematical, statistical, and epidemiological models. And to achieve this task, he developed rigorous quantitative tools and evidence-based forecasts. And Gerardo currently has already several federal grants tackling COVID-19. Our second panelist, Professor Damiani, is a professor at Università degli Studi di Milano in Italy. Simultaneously, he's also the senior director of Artificial Intelligence and Intelligent System Institute at Khalifa University, United Arab Emirates. He also leads the big data area at Etisalat British Telecom Innovation Center, and he's the president of the Consortium of Italian Computer Science Universities, CNI. Ernesto's research interests include artificial intelligence, machine learning, big data, edge cloud security and performance, and cyber physical systems. He has been the principal investigator of a H2020 European project on big data as a service, and among many awards that he has, he is also the recipient of the Steve Yao Award from the Services Society. Currently, he is leading the COVID-19, he's part of the COVID-19 Research Task Force at Khalifa University. Our third panelist, Murat Kantarcıoğlu, is a professor and the director of the Data Security and Privacy Lab at the University of Texas, Dallas. He's also currently a visiting scholar at Harvard Data Privacy Lab. Murat's research is in cybersecurity, machine learning, data science, and blockchains, with a specific focus on enabling machine learning applications. Murat's research has been funding from several federal research agencies, including NSF, AFOSR, ARO, ONR, NSA, and NIH. Murat is also a recipient of various awards. He's a recipient of the American Medical Informatics Association's Homer R. Warner Award, and also the IEEE Intelligence and Security Informatics Technical Achievement Award. He's also a distinguished scientist of ACM. Murat currently is a recipient of an NSF grant specifically focusing on technologies to safeguard patient data during COVID-19 research. Balakrishnan Prabharakan, Dr. Prabharakan is currently a program director at Human-Centered Computing HCC program at National Science Foundation. He's also involved in several programs at NSF involving secure and trustworthy computing, fairness in artificial intelligence, and future of work. These are all basic things that are very relevant to the panel that we are having right now. He's also a professor of computer science at University of Texas at Dallas. Prabha is a member of the Executive Council of the ACM Special Interest Group on Multimedia, and he's also currently a co-chair of the IEEE Special Interest Group on Video Analytics. His research efforts are funded by National Science Foundation, ARO, US Ignite program, along with several industrial sources as well as consortiums. Prabha is a ACM Distinguished Scientist and IEEE Senior Member. Our final panelist, Dr. AJ Royoru, is currently at IBM Research Labs, and he leads the healthcare and life sciences research. His background is in molecular biology. He has a PhD in molecular biology, and his team at IBM Research is primarily focusing on science, technologies, and translation insight on biomedical challenges, including cancer, cardiac, neurological, mental health, immune system, and infectious diseases. AJ is an IBM fellow. He's also a member of several prestigious organizations, including International Society for Computational Biology, IBM Academy of Technology, and IBM Industrial Academy. And AJ currently co-leads the accelerated science efforts in IBM's response to COVID-19. So the panel organization will be basically, we will have, after my introduction, which is about the end, we will have position statements by the panelists. This we expect it to be basically 5 to 8 minutes. And then after that, we will have time for a Q&A and discussions. So we wanted to have this Q&A discussion focus as open as possible. Obviously, smart data and COVID covers a pretty sort of broad spectrum of questions and challenges, from epidemic modeling, vaccine development, work-life balance, testing policies, disease tracking, privacy, healthcare delivery, information misinformation, social care, resilient aging, emergency response, apps and devices, and societal engagement. And we hope that basically we will be able to touch at least a reasonable portion of this during this panel. But briefly, again, just to repeat myself, the key question essentially, right, so that basically we are asking to the panelists is, how can smart data services help enable communities where we live and work in harmony, collectively, and we function resilient, sustainable, and livable with and beyond COVID-19? So that's basically the question. Before we start the position statements, I would like to finish basically with a brief reminder about our sort of sister panel and the keynotes. Almost right after basically this panel, we will have a keynote on digital health and beyond, what computing can do to transform health, by Wendy Nielsen from National Science Foundation. After that, we will have a panel on future of home office school in the age of pandemic, chaired by Sheikh Iqbal Ahmed from Marquette University. And then on Friday, we will have a second keynote focusing on smart data services in human-centered dynamic systems. We hope that all of you will also attend those keynotes and panels, and we hope that you will basically find those useful as well. With that, I will stop, and I will welcome the panelists once again to the stage, and I will give the baton to Professor Gerardo Chawel for his position statement. Gerardo?
Hi. First of all, thank you very much, Selçuk, for the invitation. It's a pleasure to be here with such a distinguished group of scientists. Can you see my slides? Can you hear me and see my slides? Okay. All right. Okay, great. So I'm a mathematical epidemiologist and professor of epidemiology and biostatistics at the School of Public Health at Georgia State University. So I am very interested in developing mathematical computational models to understand the spread of infectious diseases, and at the same time devise smart interventions to prevent and mitigate the spread of epidemics, right? So we have been very busy in the context of the COVID-19 pandemic. These mathematical models can vary quite a bit in terms of complexity, right? Depending on the type of structure in the model that we need to address the question at hand. So this complexity can range from models that stratify the population in groupings.
Gerardo, can you hear me? This is Murat. It looks like your slides are not showing up. Can you get out of the full screen mode and share the entire screen and then redo it? So apparently you are sharing only the application, not your full screen.
Oh, okay. I'm sorry about that.
No problem.
Share screen.
Full screen, entire screen, and then do that way. Okay. Make sure you close your emails. We will see.
Yeah, I was wondering if. Okay. Everything is good. Can you see now? Can you please confirm?
I will wait Tom to project it.
Okay. And should I?
Full screen, you have to see. Okay. Yeah, it's good. Now I can see it correctly.
Okay, I'll go very quickly. So as I was saying, I am a mathematical epidemiologist. So I develop and apply mathematical and statistical computational models to investigate the epidemiology of infectious diseases and also develop intervention strategies to prevent and control transmission of viruses and all of these new pathogens that are emerging and reemerging. The model complexity can vary from models that structure populations in different groupings. It could have a spatial structure where the individuals living in each patch interact with each other uniformly at random, or it could have different layers of complexity where the individuals are structured in households, in workplaces, school settings, etc., etc. So the level of complexity often depends on the amount of data that we have available. In the context of this panel, where we have multiple data streams, smart data streams, as Sergio mentioned, it would make a lot of sense to use highly detailed mathematical models, such as agent-based simulation models. And these are some of the models, the type of models that we are using in our research, including projects with Sercook. And the type of questions that we want to address range from trying to understand how quickly the pathogen is spread in the population, what are the modes of transmission, and evaluate different control interventions, and look for optimal allocation strategies of limited pharmaceutical interventions, such as therapeutics or vaccines. When we have a new virus, a completely new pathogen spread in the population, such as SARS-CoV-2, we really need to rely on models that do not make strong assumptions about the epidemiology of the disease, because we don't have enough information to characterize the epidemiology and the modes of transmission. And so we have been developing what are called empirical or phenomenological models. And specifically, this subepidemic wave model has been very useful to characterize the waves of transmission in different parts of the world. And essentially, with this type of model, a wave is characterized by the aggregation of multiple subepidemics. And in order to do this, we rely on a system of differential equations where we characterize the rate of growth, the scaling of growth, the size of the subepidemics. And all of these subepidemics are linked with each other through this function. Essentially, the next subepidemic is triggered once the previous subepidemic reaches a certain number of cases. And by doing this, we can characterize complex dynamics that go beyond the simple single peak dynamics that characterize most of the transmission models that are being used these days. So with this type of model, we can generate traveling waves, we can generate epidemic with broad peaks, we can generate epidemics with long tails, et cetera, et cetera. And so we have been using these type of models to forecast the COVID-19 pandemic in different hotspots around the world. This is an example using data for the USA, where you can see that the model early on is not able to characterize the leveling off of the disease, but once it gets more and more information, the model is able to infer subepidemics, and by doing that, it's able to forecast in the short term where the trajectory of the wave is going. So it relies on information on the information that is available in time series, rather than making assumptions about the specifics of the epidemiology of the virus. And we have shown that this type of model actually outperforms simple models that tend to assume a single peak dynamic. These are comparisons with different performance metrics, including the mean absolute error, the mean square error, the coverage rate of the 95% confidence interval, and something more complex like the mean interval score. And so I think the powerful thing in this type of models is that with this type of models try to infer what's going on inside the wave, right? And by doing this, we are able to characterize resurgence as well, the resurgence of the virus. And this is showing specifically the resurgence that we saw this past summer, and characterize and do a good job in the short term in terms of the peak timing of the virus, of the epidemics. Although, as you can see, there is substantial uncertainty associated with the high variation in testing rates that is inherent in the data. The models can also be used to investigate optimal allocation policies of pharmaceutical interventions. So as time goes on and we learn more about the epidemiology of the infectious disease, in this case of COVID-19, we can better characterize the duration of incubation times, the role of asymptomatic individuals, pre-symptomatic transmission, and so forth. So we can develop more detailed models that we call mechanistic. And with this type of models, we can search for optimal intervention strategies that could help us determine where, for instance, in this case, vaccines should be allocated in the population. And by doing that, we have our preliminary findings indicate that, for instance, vaccines of limited efficacy should be targeting essential workers. And in particular, these interventions may vary depending on the objective. The objective of the public health policy. Do we want to minimize the number of deaths? Do we want to minimize the years of life lost? Or we just want to minimize the number of infections? And with this, I think this is all I have to say. I think these models have a lot of potential to integrate into smart data streams, specifically to develop smart strategies that would allow us to live with these new pathogens that are emerging and re-emerging in our world. Thank you.
Thanks a lot, Gerardo, for the great presentation and highlighting the need for social distancing, effective testing policies, and also the question, what do we minimize for, right? So what's our goal, right? So as a society, right? So what do we want to achieve? So these are very critical questions, and I'm sure we'll discuss them further. Next, I would like to welcome Professor Damiani to make his position statement. Ernesto, would you like to?
Okay, thank you very much. I hope you can hear me. And also you can see my shared screen. So I will continue under that assumption. So the work we're going to report, which is the COVID-related one, and also I hope it can be the starting point for further discussion. I think is very complementary to the previous statement that I heard. It has been carried out at Khalifa University. Here you see something where it's not, I mean, is the major educational and research institution in the UAE. And we are running 3 institutes there. And of course, this is the one that I lead. It's called today is called the Robotics and Artificial Intelligence Institute. And basically, what we do under this institute basically is doing devices. We do communication between the devices and the center, and both at the center and the periphery, we try to do data analytics. So this is the 3 pillars of the research and development that we run at this institute. And basically, we were called in the UAE COVID effort. There's been a team effort among all the research institutions in the country. And I would like to tell you something about the work that we did in that framework. Okay, so first of all, we are in the area of spatiotemporal statistical models. Basically, we are using mobility models to try to model the transmission of the infection. And this is something that is very controversial, of course, because the tracking and tracing of people also has created concerns. So I would like to clarify a little bit what we are doing, what it is with respect to other similar work that you probably have heard of. I hear an echo of myself, so maybe there's someone who has not muted the mic. So first of all, let me tell you what Places is not, because I think it's useful to also mention this type of, let's say, a negative image in the sense that it is the inverse. We are not working on encounters-based type of tracking and tracing. This is, of course, a very important area in which you basically have applications that will use device-to-device code exchange in order to create privacy-aware lists. Of course, these codes are anonymous, they are changed periodically, but the idea of these applications that we all know of is that they store locally on your device a list of the people you met, of course, with all the type of arrangements that can preserve privacy. And then if someone is positive and you get to know the code used, you can sort of compare it with your list. And if there is a match, you know that you met someone who was infected and you can ask for assistance or be tested or whatever. So if you are interested in going through the wealth of the algorithms, the techniques that are behind the apps that most countries in Europe and many other countries in the Middle East are using today, I prepared a webinar. You are very welcome to go and hear 1 hour and a half of discussions about what is behind that type of application. It's mostly privacy-aware notification. This is not what we are doing. We are doing the old style tracking and tracing based on network activity. So you go around with your phone in your pocket, the network will know where you are. It will know based on the activity that you do on the network. And this is used commonly for the type of, for example, criminal investigations with the authorization, of course, of a judge or whatever. And this classic way to characterize, to follow people around is through their CDRs, the call detail records. These are old style ones that you can see here, very old ones from 2011, and they basically are from the New York area. But they show you that your phone is talking to the cell. It's telling the cell something, but as a result, the network knows where you are with the approximation of a cell. These days, we can do much better than a cell. You see the center of Abu Dhabi here. And the center of Abu Dhabi, thanks to the operator equipment that we have in this particular area, we can sort of pixelate the cells with sort of a resolution which is not far from the GPS. I mean, just squares of 30 to 50 meters. We can identify where the phone was when the activity was done. And so this basically is the key for following the phone around. And we can do that. Of course, I'm saying that the operator can do that. And with all the low permissions, I'm not saying that I do it, but without your permission. But this can be done. And this doesn't depend on you having installed anything. This is just the network activity that your phone will do anyway. So, of course, there are a lot of ways of lifting this type of data in order to give it a certain level of anonymity. And I don't want to enter into this. It's a very important part. Of course, the data are not anonymized when you are undergoing criminal investigation. In that case, the judge gives the permission to the operator to share the data in non-anonymized form. If we are going to run a certain model on top of this mobility data, we need to anonymize them. Otherwise we won't get the permission of working on them. So let me show you the architecture so you understand what I mean. The operators have the right to hold this data by law, and you give them the right when you subscribe your mobile phone contract. So we do pixelation and we do anonymization at the mobile operator site. So we don't transfer the data out of it. And of course, according to the different government prescription, we need to do certain level of anonymization. At the ingestion time, we create a data mesh, which is an inter-operator data space where we will run our spatiotemporal models. By the way, we are also running on top a simulation of the encounter software, because you can regard the data we have here as the digital twin in the sense of the phones that you carry around. And whether you have the app installed or not, we can run a simulator of the encounters type of approach. But mostly, we run a spatiotemporal model on top. And let me just say something about the ingestion. Of course, the ingester is a software that actually runs in the authorized data space of the network operator. It doesn't run in a network environment which is not authorized. It will run in a sandbox, and it will export the anonymized data. So when I say anonymized, I can also unlink entirely the CDRs, meaning that two different CDRs from the same person, well, I will forget that they are from the same person. But still, there are useful spatiotemporal models that they can run on top, even of entirely unlink the data. Okay, so I think that you see here what we do. We have an interoperator smart data mesh. It's based on a graph database. Now let's come to what we are doing on top of it. First of all, we are doing covariate studies, and this is something that has been done in a number of places, but every time you must redo it, because of course the fact that adding some additional information, covariates, that can be, of course, context information, will actually make will actually allow you to make more, let's say, more trustworthy statistical inferences. This is something that it has to be sort of checked again and again for every specific application place. So here we are looking whether knowing a certain descriptors on the destination, meaning the purpose of areas, is useful or not. And so we are adding these as covariates to the information about the position and the duration and of the stay in a position of each individual phone. Whether it's linked or unlinked, it doesn't matter for the covariate study. Then we run probabilistic models. Of course, probabilistic models have been designed by the statistician and the epidemiologist within the California University. But just to give you an idea of what we do, we basically run iterative studies. When we have unlinked the data, these are just, let's say, Monte Carlo or Exodus models, in which we iteratively try to characterize how many people will, starting from the positives, we know how many positives and where they were at the beginning. We run iteratively the model in order to be able to estimate how many positives I can expect and what will be their distribution. If I have unlinked the data, I can only estimate the number of the positives, but if I have linked the data which are anonymized in different forms, I can still also give some sort of a hint of where and how the infection will propagate. Okay, this is it. I think that tracking and tracing based on the network is the complementary to tracking and tracing into the notification services based on the device to device. So I'm really looking forward to discussing in the panel further how this type of application will be used in the future and how can we basically reconcile it with the concerns that have been raised about the privacy.
Very, very nice. Nestor, thanks a lot for highlighting the importance of smart data services in tracking and tracing, especially highlighting the importance of scalable data management, data-driven analysis and modeling, and also basically pointing out the need for privacy and security in this context. And this perfectly ties to the research focus and the position statement of our next presenter, Murat Kantarcıoğlu. Murat, would you like to take the microphone?
Yes, let me present. Hi, my name is Murat Kantarcıoğlu. I would like to say good morning, good afternoon, or good evening, wherever you are. And thanks for Selçuk to organize this panel. I'm a professor of computer science at the University of Texas at Dallas. And this is a joint work with my colleague, Brett Mellon from Vanderbilt School of Medicine. And our focus is really to enable this smart data services by sharing data. And as Ernesto put it very nicely, that there's really a privacy issues here and understanding and need to address privacy issues. But of course, in our work, in our current work, we focus more on sharing actual data to answer questions such as how race impact like COVID-19 mortality, for example. There is some discussion in the US, some certain race groups are impacted much more severely than the others. Of course, to answer these kind of questions, you need data, and you need to share this data with the public or with at least with the researchers. And of course, data sharing, during data sharing, the privacy concerns could hinder such data sharing. One example happened in the US during summer. Some researchers from University of California, Berkeley, and Stanford wanted to access some COVID-19 data, but California state officials didn't want to share it because they think it may violate privacy. So they didn't give the data. And of course, they are right to be concerned about privacy. More than 25 years or so, it's been known that data sources such as COVID-19 patient data could be linked with outside sources such as voter list. So so basically, if you share COVID-19 patient data with zip codes, age, and gender, easily that could be linked with voter registration lists in US, where this is some of the information is public, and you could really join these two data sources to identify individuals. And actually, for example, this kind of attack somewhat applies to what Ernesto was showing, because people, for example, usually stay at home in the evening. So if you know the base station in the evening and the daytime, you can sometimes triangulate the home addresses to some extent. So this kind of attacks have been known for a while. So, and there are lots of research have been done on this, including some of our work. So of course, the question is, what is difference when we have pandemic? One thing is that when we do this privacy analysis, whether it's sharing this type of patient-specific data or maybe location data and so on, now we have new sources of re-identification data. Here, for example, this is what I'm showing is a New York Times article where they look at some of the people who lost their lives during this COVID-19 pandemic and share their information, such as the Patricia Dodds, 57, from San Jose, California. So this information may use to rule out some certain matches and can improve can increase the identification risk. And of course, now this creates new challenges in addressing privacy risks in sharing data. Which one issue is that attributes that are needed can be changing. For example, I've seen conflicting reports over the months whether smoking helps or that with the COVID-19. I think one research from China claims that it reduces the risk of severe outcomes in COVID-19 if you're a smoker. In another study, I think from France, they claim that it actually increases the risk. So now the issue is that you need to maybe collect more data so that you could understand this. So now we want to share smoking information, for example. How will that impact the risk? And of course, the case numbers are changing rapidly. The implication for this is that when the pandemic starts, giving very detailed data may cause re-identifications. But as the pandemic progresses, where we have more data, then the identification risk might go down. So therefore, we need to really constantly relook and reevaluate this privacy risks. Of course, for those who know differential privacy and other things, here we are looking into patient-specific actual data, but not adding noise to data. And we can have a discussion on it during our discussion session if you are interested, because based on our discussions with healthcare professionals, they want to have access to non-noisy data because already there's so much uncertainty in the COVID-19 and other pandemic developments. So adding noise could really hinder the understanding of the developments. So we are looking at different variations. So given the privacy goals, what's the best possible utility that we can provide to answer these kind of studies? And of course, we also heard this argument from some of our collaborators where they were saying that, we don't want to give up on data utility goals because this is such a critical issue. So we cannot lose any utility from the data. So now what we are really looking into, what's the best possible privacy we can achieve. Our past research showed that under the same data utility, for example, data utility could be the success of a model in predicting new cases. Different choices may have different privacy implications. Therefore, still we have room to provide the best possible privacy. Of course, an ongoing discussion is what's the good use cases, what's the good data utility, and that's something we are working on. So currently we start with initial Monte Carlo risk estimation for entire US now. And basically, given the case reports and the census information, we are now generating thousands of hypothetical patient groups and analyzing how they can be uniquely identified under certain data disclosure rules. And we are developing some confidence intervals. So hopefully we will share this result soon to guide local, we are doing this for county basis in US to guide local data sharing policies. So to conclude, I didn't go into the technical details, but our entire identification risk framework is based on our past work on game theoretical modeling of the risks, utility, and attackers' capabilities. So we are really extending that framework for pandemic data sharing by considering this rapidly changing dynamics of pandemics. And our ultimate goal is to provide this guidance per county basis in US on the privacy risks. So please contact me in a few months on that tool. So, and I would like to thank NSF for this rapid grant that allows us to do this analysis. So thank you.
Thank you, Murat, for the very nice presentation, highlighting the trade-off between data utility and privacy, and also highlighting the potential impact of privacy concerns on urgent scientific questions that we all want to answer. And this lecture ties very well with our next speaker, Dr. Prabha Khan from Nation Science Foundation. And I will invite Prabha to give his position statement and maybe also comment briefly about some of the issues that Murat have raised. We will, of course, have additional time to discuss those later. Prabha, do you want to take it over?
Hi, everyone. Thanks, Selchuk, for having me in the panel. My name is Prabha Prabhakaran. I'm a program director with the Human-Centered Computing Program. If you know National Science Foundation, it is organized in terms of directorates. I'm in the Computer Science Directorate in the Information and Intelligence Systems Division. Next slide, please. So a little bit about me. As a researcher, my background is in the broad area of multimedia systems. Currently, I'm working in multimodal mixed reality systems and applications, targeting healthcare and education. So for healthcare, I'm working with physical medicine and rehabilitation experts, using mixed reality for phantom pain management for amputees, in-home rehabilitation, and remote assessment of musculoskeletal issues. We also worked on immersive environments using a sensor put on the tongue for training and evaluating speech impairments. And that's also a 3D system with magnetic and electromagnetic sensors. On the analytics side, once you collect data, we have worked on association rule mining and motif discovery, or self-pattern extraction. And currently, you cannot escape from machine learning, right? So I'm also working on explainability frameworks for deep learning models that deal with the healthcare data. With this background, my job in NSF is in different programs, such as Human-Centered Computing Program, National AI Institute. We have a new theme on human-AI interaction and collaboration, and the deadline is in December. Future of work at the Human Technology Frontier, secure and trustworthy cyberspace. There's also a program on smart and connected health, which I will discuss more in detail. And I'm also involved with REU Science research experience for undergrads. Next slide, please. So I think for this panel, maybe all of you have been talking about different things, but I guess the underlying question is, how do you make health smarter, right? Next slide, please. So if you look at medicine as such, it's very interdisciplinary even within medicine, right? I mean, you have a lot of subfields in medicine, but more and more, medical advancements are taking advantage of research in engineering, mathematics, and computing, right? So next slide, please. So there is a need for people to work together with medical professionals, right? So collaborative efforts involving engineering to devise smarter sensing platforms, right? Computer scientists for analyzing this data, and other disciplines as well. Next slide, please. So primarily, if you look at the Smart and Connected Health program, the Smart and Connected Health program is in Computer Science Directorate, and the Computer Science Directorate, apart from SCH, has few other programs. Cyber Physical System, that deals with the development of devices that can be used for health monitoring. It's called CPS. National Robotics Initiative 2.0. I mean, a simple example is teleoperation or telesurgery, right? And robots for healthcare assistance, helping nurses and doctors in the surgical room and day-to-day care. Other core programs, for instance, human-centered computing, deal with a lot of community-wide health or citizen science-based health systems and applications also. Next slide, please. So focusing on smart and connected health, the goal of Smart and Connected Health program is to advance research that would help, or that would seek improvements in safe, effective, efficient, patient-centered health, and you can call it precision health or personalized health also. And this is done through innovations in fundamental computer and information sciences, engineering, and it can also involve social and behavioral and economic sciences. So the idea is that the activities should complement other agencies' work, such as NIH, and not duplicate. Next slide, please. So how do you transform overall health, right? So many of you have been talking about these points, right? So from individual data to connected people and systems, right? From experience-based data based to data and evidence-driven research in healthcare, right? From healthcare to health, right? How to promote individual health. That extends to home, community, as well as workplace. And the last point is really important: move focus from devices to connections between data, devices, systems, and people. Next slide, please. So the program targets multiple research areas, or encourages PIs to submit research proposals in multiple areas. The broad areas are health information infrastructure, connected data. How do you reason with heterogeneous data? Considering the uncertainty underlying the data. Connected systems, that would be dealing with multiple devices for the same person, multiple sensing for the same person or a community as a whole. Connected people, and that would be, it could be tracking, it could be citizen science, right? How do you engage the communication among multiple people and use it for understanding health-related issues, as well as giving guidance for health-related issues. Next slide, please. The faculty early career program is also relevant for SCH, even though it's not separately called out. The young faculty are encouraged to submit career proposals targeting healthcare applications to smart and connected health program. Next slide, please. So I think the underlying theme is that for healthcare, the efficient way of doing research, or the effective way, is to consider this as a relay between basic and applied science. And cognizant of that, we have had a workshop in the Smart and Connected Health program targeting privacy and security. A topic that Murat was touching upon, and we want to have a specific agenda item either in SATC or in SCH, or maybe both, that would address privacy and security in healthcare data. So that would also be a very relevant research area. Next slide, please. So I would end this, my position statement. I encourage you to join the SAIS announcement list and the IIS mailing list to get more information about research programs. Couple of things. Being selfish here by encouraging all of you, people who can, to serve in NSF panels. We need reviewers, we need community to support the evaluation of the research also, right? Not just submitting research proposal. And the second thing is to talk to us about your research. Is it relevant to this program, or is it relevant to that program? And talking to us, not just me, any other program director in the programs that I talked about, that helps you to frame your research in a successful manner. I'll stop here. Thanks, Selchuk, for having me.
Hi, Prabha. Thanks a lot for the great presentation, highlighting the need for making data smarter, data and evidence-driven research, bringing healthcare to home rather than basically people to healthcare, maybe, right? And emphasizing connections rather than devices. So I think these are all basically very sort of important sort of points. And I know that our next speaker, Dr. Royer from IBM Research, also has some ideas and thoughts on these. And with that, I will basically invite AJ for his position statement. AJ? AJ, we are not able to hear you. I think you need to unmute.
My bad.
No worries.
Okay.
Now we are able to hear you.
Thank you, Selchuk, for the opportunity to be on this very distinguished panel with my colleagues here. And I'm going to take the opportunity to describe to you the experiences me and the team here at IBM and IBM Research have had, particularly with regard to what we are doing in COVID, and with a slant towards data services and data science. So I'll begin by actually first talking about what COVID did to all of us in the science community, right? It actually emphasized the urgency of science. And in fact, if we are going to get out of this crisis mode, it is going to be through answers that science is going to provide, right? So the urgency is very acutely brought forward. We at IBM have thought through this and are doing several things, of which three I'm going to talk today. One is, and with regard to data and data services, the emphasis is really on not just the raw data, but actually how to turn that raw data into trusted information. And so I'm going to give examples of that. Second is how you use data and models. As several of the panelists have already described, multiple models are being created in epidemiology, in genetics, etc. How do you bring those to actually accelerate the discovery process? I'll talk a little bit about that. And then thirdly, how do you render them as services? And in fact, the need for services and how people will consume these services is itself changing due to COVID. So those are three things I'll talk about. Let me start with trusted information. We began in our experience of COVID, not just in IBM, but globally as a community and society. We began with knowing very little about COVID, and immediately more and more was being discovered, and there was not enough transparency or availability of information to begin with. So there is an acute need to actually turn that raw data and spotty information into trusted information. I'm showing here some glimpses of examples that we in IBM have been pursuing that take this available data, turn that into from reliable sources and turn that actually into trusted information and serve the community at large. Over on the left, you see an example of a capability that has existed in IBM called micromedics, which is used by physician practices or pharmacy to actually look at online databases of drug information, toxicity, etc., and best practices in all sorts of procedures. So we've actually brought that to bear together with Dynamed as the partner and made that available specifically for COVID, and that is actually getting used extensively worldwide. Over on the top right, I'm describing a functional genomics platform that we at IBM had been constructing and pursuing for microbial genomics in many different ways already, but we took that platform and actually aggregated all the information that is available at the genomic level for the SARS-CoV-2 genomes and all the samples that are getting publicly described at the genomic level. We brought those into the functional genomics platform, and the services that are now wrapped into the analytics with that data is now available on a website that you can get to from the link I'm showing here. Thirdly, the example I would like to talk about is the explosive nature in which scientific discovery has occurred and continues to occur, and a large corpus of new knowledge is getting published. For example, the public corpus called COVID-19 is one very well aggregated example of that. But think of that as just raw data, raw content that is getting published in every paper with its own conclusions. And what you now need is actually knowledge management methodologies that allow you to look at trends and connections between points of evidence and data across these papers. So we at IBM have developed techniques for either deep search or literature Q&A that then use this corpus as the ingestion and then provide added services on top, and you can get to those again from the URL shown here. So that's an example where we are accelerating, the dissemination of knowledge and information to the scientific community and practicing community using these tools. Next, I'm going to show you examples of the data of incidents and the data of interventions, particularly non-pharmaceutical interventions, that we all need as researchers and individuals to make better decisions. So over on the left, I'm showing you a dashboard that IBM publishes, updated on a daily basis that provides a variety of aggregated information from all geographies around the world, including incidents, including both the statistics of incidents as well as mortality by geography. That's what you see as a snapshot on the left. But if you go to that link and browse to the tabs, you will also see what is shown there as global non-pharmaceutical interventions and the US non-pharmaceutical interventions, which is the picture I show on the bottom right, which is a very interesting aggregate of all the non-pharmaceutical interventions, namely things like school closures or restrictions on mass gatherings or restrictions on travel, etc. There's a large collection of categories of interventions that we tabulate in there. And then we show that actually as both by geography, state, local, and country level, as well as by time and day. So you can actually see what for particularly to serve the modeling community, this becomes a very useful resource as an input, because each of these interventions then actually changes something in the input that goes into these models, right? Because the boundary conditions are changing as these interventions get imposed or lifted. Again, from the website shown at the bottom left, you can get to that, and the entirety of the NPI dataset is being made available in an open manner to the external community, and you're welcome to come take a look at that. So that's on the data side. Now let me turn also to how models and services are becoming available. So from early in the experience of us reacting to COVID, IBM took a leadership position in providing high performance computing, and we gathered together actually a coalition of aggregate of federal government as well as private, other cloud and compute service providers. We all came together and created this COVID-19 high performance computing consortium, which as of this week has on the order of about 600 petaflops of compute capability that is made available. And it supports, as of today, on the order of about 89 different projects. And on this website, you can come and actually submit your proposals, get them reviewed and supported. And that's a way of accelerating the modeling and inferencing that is being done. It's not just for molecular modeling, it is also for AI techniques. There's a lot of GPU resources as well available here, and that's accelerating the science. Thirdly, I'll talk about the evolving services, because you have data, you have models, but then eventually decisions have to be made and people have to be supported, both individuals as well as institutions. What I'm showing you here is ways in which we support decisions at the individual level. Many of you are probably familiar with your weather app on your phone. A large number of those are actually weather service provided through the weather channel, which is an IBM business. So we have added to the weather channel actually a weather.com/coronavirus link that if you go there, you actually get to see incidence information for the local geography, and that can inform you, your family members, in decisions you have to make with regard to activities and social distancing and or gathering, etc. So that's up-to-date information, that trusted information that is being delivered in this manner. To the institutions that IBM serves, our large clients, they have an additional issue that each of us as large clients have to address, which is, do we bring back people to a workplace? How many, at what moment in time? And how do we even screen and manage the people who are coming into the workplaces? And that's whether it's a large employer, large academic institution, we all face that issue. So there's a collection of IBM services that are now available together called Watson Works that do things like worker safety in the workplace, contact tracing, managing permissions for entry or re-entry to the site, as well as redesign your occupancy in the floor or the workplace site to manage the distancing properly. And of course, also do things like customer service assistance, etc., to help answer questions. So that's sort of a collection of services that are based on some of these models that we are able to serve. So I described to you, the three things that we are doing in aggregate as data services. Serve trusted information, provide ways of accelerating discovery, and then deliver some of those as services, in particular new kinds of services that COVID is asking us to provide. With that, I'll stop here and give it back to Selçuk. Happy to answer questions via the panel.
AJ, thanks a lot for your position statements, especially highlighting the need for trusted information so that we can actually make trusted decisions. And also highlighting basically the need for industry, government, and researcher collaboration in solving many of the challenges that we are facing. HPC is one of them, obviously. and there are many of them. So with that, I think basically I will open the floor to Q&A from the audience. I'm not entirely sure, basically, unfortunately, we don't see the audience from this interface. So so what I will do is to give some time for the audience members to basically formulate their questions. I will basically start with a question that is for the entire panelists, right? So I would like to hear, I mean, we have basically, so each one of you basically gave your view of opportunities and current state of the art in different aspects of COVID-19 and pandemic response, right? And I would like to hear your opinions about basically the gaps, right? So what are the technological roadblocks, especially in data services, right, that we do not know how to do right now and can basically be a showstopper, at least in the short term? So if you can, I mean, are we basically just need time to basically resolve all of these things, and we will basically in say 6 to 12 months or maybe 3 years we will actually have solutions, or are there actually real roadblocks that basically will result in maybe no solution, right? So certain things that basically we envision will not happen, right? So I would like to actually get your opinions about about these roadblocks. And maybe we can go ahead and start with Gerardo, and then we can basically go around the table, and you guys can basically give your opinions about basically critical gaps and mission critical gaps in the technology and science. Gerardo?
Okay, thank you. That's a great question. So being a mathematical epidemiologist, I'm always looking for ways to connect these models to real-time data streams. And sometimes it can be a challenge to be able to connect to data that is coming in different formats. And so having a common standards or protocols to be able to connect to these multiple data streams, I think will be very important. I'm not sure if that's something that is being worked out, so that when we have new data stream, we don't have to spend too much time in understanding how the data is being collected and be able to reliably use the information and understanding what the data means, right? To be able to connect it properly to the model. Another issue that we have been actually discussing with Chet Cook recently is there are many models and there are many tools out there, software, right? But we lack standards, I think. We still lack protocols to be able to store this information in a coherent way so that we can retrieve it later on and have an archive, a historical archive of all of these efforts that are being conducted, that are being developed, so that all of this information and technology is not lost. So I think there's a need for, at least in the area of modeling, we need protocols, standards, and practices so that we can all talk to each other and build on top of the efforts that others are conducting, right? So yeah, I would welcome your comments on that. Maybe there are efforts on that I don't know, so thank you.
Thanks, Gerardo. Ernesto, do you want to pitch in next?
Yeah, I can add something about, I believe that the data acquisition part has been the one where we have been basically facing the most difficulties. Due to the fact that even when we had a common metadata, we didn't have the common protocol for the data acquisition. So setting a metadata value in a particular setting was not exactly the same as setting it in another setting. And even in Europe, where we have a lot of integration and years of projects for integration of the clinical data, frankly speaking, I saw not really consistent way. So how can you, for example, I mean, you want a predictive model, and the predictive model is based on data and metadata with context information. But if the context information is not filled in a consistent way, then you are sort of have drift effects that will sort of poison the model that you will be using, even if it's a very good model. So I find this even in Europe, where we have a sort of a 20 years of let's say, tradition in working together across countries, and I've been part of so many transnational projects, well, that I lost count. On the other hand, if you look at the region where I'm operating now, the Gulf region, well, this is, from that point of view, is even, I mean, there's even no story of history of collaboration. And so having standards for the format and the metadata sets that are used is only a first step. We need to have protocols for data acquisition if we want to conduct studies that go, you know, horizontally across regions. How the pandemics, by definition, requires, because you don't have any localized outbreak, you have a situation in which you need. So, I mean, I see this. I mean, we need to be prepared for the follow-up of this one and for the next ones that might come by creating some international effort for having this type of protocols in place. I don't think the problem can be solved, but it can be reduced. It can be alleviated substantially if we operate, start immediately. Otherwise, we will find a contradiction between studies coming from different places that are actually contradictions in the way the data have been collected or the metadata have been filled.
Yeah, and I think that ties also to what Murat was mentioning about different studies actually might give completely contradictory results. Murat, so can you take next? I mean, is privacy a roadblock in scientific innovations, or do you basically focus on real solutions?
Yeah. Clearly, privacy is a concern, and I think gathering data should respect individual privacy, and it has important reasons for that. First, people will be more willing to share data. And also, I think it's at least some bias on that, in the sense that we, as a society, we need to protect individual privacy. And I believe that you can really do a good job of privacy protection and still achieve a good data utility. But also, I want to add to the privacy, sometimes what we see is that privacy is used as an excuse to not to share data due to incentive issues. We were talking with my colleague, like in Tennessee, for example, some school districts didn't want to disclose their COVID case numbers because they are claiming it's violating some privacy rules. Clearly, if you just reveal counts, it's very hard to re-identify individuals, so the privacy risk is very, very low. So I believe in addition to privacy, we need to solve incentive issues. So the local organizations should be incentivized either by regulations or monetary things or some other way to share the data. Because in many cases, if you're a local health official, sharing detailed data is more costly for you. And if something goes wrong, you will be blamed. So why to share to begin with? You know, so what's your incentive? So I think we need to really consider privacy combined with incentives to enable all this data sharing things Gerard and Ernesto mentioned. And I think AJ has mentioned government and industry collaborations. I believe that will only work if someone's paying for it and incentivizing people to share for it. Otherwise, I will see that.
Thanks a lot, Murat. So basically, so far we have standards, right? So it's a roadblock. We have context, right? So it's a roadblock. And we have incentives, right? So those seem to basically appear as some of the roadblocks that we seem to be having, right? And Prabha, maybe you can pitch in next. So is you for example mentioned about basically bringing healthcare to home, right? Is this a solved issue, or is this basically something that can be solved through obviously basically, and we'll probably ask the same question to AJ as well, right? Through industry, governments, and maybe university collaboration, right? So how far we are basically from sort of pandemic-proof healthcare services, having basically, of course, human as the sort of core consumer, right? So rather than the human patient basically being sort of a add-on to the healthcare service delivery.
Right. I mean, from research programs perspective, I think it's still a open or an unsolved problem in terms of handling in-home care, and that is primarily because when you talk about in-home care, it's really a broad spectrum, right? I mean, we are talking about people, disabled people, to people who get afflicted with some kind of illness in a temporary manner, and so that spectrum is really wide. So the research proposals that we receive are still talking about unsolved issues and unsolved problems. So I don't think it's a done deal. And what does pandemic do in this context? I think in my view, the pandemic, especially COVID, if you look at it, there is a lot of issue with surfaces, right? I mean, surface in the sense of device surfaces, touching, people coming into your home to help with those devices, setting up and things like that, right? So people are worried, both the person who wants to come and help you as well as the person to be helped, right? They're worried that, whether that, in-home equipment can be serviced, can be maintained and all that, right? So I think there are a lot of challenges, and in terms of just not the technology, but technology adoption and the engineering aspects, like just making sure that technology is working correctly, right? So those are the things I think we can look at it. We need to still look at it.
Sure. Yeah. Thanks, Prabha. I think basically we are adding to the list of potential mission critical roadblocks is the technology enablement, right? So we can really develop all these technologies, right? So, but if these technology don't function at home, or basically with basically aging and so on, it's basically you need sort of a third person, right? So to basically support those. So how does this actually conflict with the pandemic itself, right? So it is so I'm basically marking this essentially as the fourth sort of challenge within the context of healthcare delivery and pandemics. AJ, sorry, Prabha?
No, I just wanted to share a 30-second thing.
Sure.
Like, I just had my smoke detector battery going out, and the smoke detector is at 15 or 20 feet height. I mean, I cannot do it. And I left it chirping for 2 weeks before making up my mind I am going to get somebody to come and change it for me.
Yeah, no,
So
I mean,
we talk about smart environments, we talk about smart technology. Some sensors go wrong, then in a pandemic situation, it's not that
what
strict.
do you do? Yeah, I mean, I had basically at the very early stages of pandemic, my router, my connection to the cable service actually, which delivers my network, right? So was crashing, right? And I couldn't actually, even if I was willing to have them come and service, they basically said, no, we will not get into your home, right? So fortunately, I was sufficiently technology savvy, right? So to actually figure out a way to resolve it. But I can imagine that basically if this was a individual, right? So that is not as technologically savvy. I'm not that technology savvy, but as sort of understanding of those technologies, it would have been an issue, right? So this individual would have been cut from the actual society, right? And may not be able to actually participate in the work environment and the social engagement without that network connection, which is a problem. With that, AJ, I would like to basically bring you lastly for this round. So what are the mission critical roadblocks? I actually want to also get your opinion, especially since you brought basically the collaboration between industry and government and researchers. So do you see any roadblocks in that context, right? So
yeah.
So could you please comment about that, AJ?
So Selchuk, I think as a society and as institutions, we are very suboptimal at the moment in making a fundamental trade-off between public health good and economic recovery or benefit. And you look across governments, you look across institutions, everybody is forced, each of those stakeholders is being forced to actually go find their own optimal with very little of true smartness in the data that they use to make that decision. So it's very ad hoc policy making that is occurring with some attempt to get to an optimal, but there isn't really a smartness to that analysis that supports that decision yet, right? That's a very open problem. But I think we as a community of researchers, data scientists can actually do better at that. So think of the stakeholders. It's not going to be one size fits all. think of the roles that different stakeholders have, and we need to actually provide ways in which, like what Gerardo was saying, standardization of data, standardization of models, standardization of economic value that stakeholders need to be able to extract from decisions, and then allow for a systematic way in which this methodology gets used by the different stakeholders, right? So that's actually a scientific effort that needs to occur, where I think today we are being very ad hoc. In the moment of need, we're compelled to be that ad hoc. But if you look ahead and you say that such pandemics are going to continue to occur and we need to be prepared for it, one of that aspect of preparedness is this better methods of getting this trade-off between public health and economic recovery or economic good. And so, I think that's scientific direction that we have to unlock as a lesson from this experience.
Yeah, thanks, Teja. I fully understand, and I agree. What we optimize, right? So systematic understanding of what we optimize, and also basically having an understanding of who our stakeholders are and what they need and how we prioritize them, right? So that requires basically, when we want to urgently respond, we need basically actually a basis for that, and actually that's tied basically with what Gerardo was saying at the very beginning. Right, so as if we are going to basically be developing policies, right? So any decision making, right? So we need to actually know what we optimize for.
Right.
So I guess with that, I guess we just ran out of time. If my understanding is correct, if my schedule is correct, so we had time until now, so I think I have plenty of other questions that I want to ask you guys, but I think this was basically very lively, very informative presentations and position statements from you guys. Much appreciated for participating. And I think basically this last question was anyhow a collection of multiple questions, and I think it was important for us to understand what basically the mission critical issues were. And I think we identified standards, context and data acquisition, incentive, the technology enablement, especially basically people who are not technologically savvy, or they may not have basically actual access to technology because of the pandemic, right? And finally, understanding of the stakeholders and a systematic study of what to optimize for. So these basically seem to have emerged as basically the sort of potential showstoppers in urgent COVID research and smart data service delivery for those. I think we might consider making a maybe position statement later on of this, and I will basically reach out to each one of you, and maybe basically we can follow up on this discussion. With that, I think I thank you all, and I would like to thank you and clap, and that's it, guys. Thanks a lot.
Thank you. Thanks, Sajid.
Thank you.
Thank you.